Hi, my name is Boon Lim. I'm a consultant cardiologist at Welbeck and the chair of the Cardiology Board at Welbeck. We're going to talk about blood pressure today, and I'm going to cover some of the most commonly asked questions that my patients have for me in relation to blood pressure. So what is a high blood pressure? Essentially, if you have a blood pressure monitor at home and you have consistent readings under 130/85, I think you have got a normal blood pressure, and anything above that consistently should be a slight cause for concern. So patients also ask me, what is a normal heart rate? Now, the normal heart rate is a range. It's not a heart rate for an individual. It varies depending on so many factors, including your age, your sex, your level of fitness, what you ate for breakfast, lunch, how much coffee you've had. So the normal range is suggested to be between 60 and 100 beats per minute. But if you're fit and healthy, your resting heart rate may be much lower, something like 45 and 48 beats per minute when you're resting. How often should you check your blood pressure? I would suggest that if you know that you have a normal blood pressure, you might just want to get it checked once a year. What I would definitely say is that if you do several readings and they're always above the threshold values, so above 130/85, I would recommend that you take your blood pressures ideally consistently for 2 weeks, twice a day. See your doctor, your general practitioner, or book an appointment to see a cardiologist to discuss whether or not you need further investigations. Can stress raise blood pressure? Of course. And one of the things that you should be aware of when you're taking your own blood pressure is how to measure your blood pressure. You should be seated in a comfortable position, legs uncrossed, calm, not answering emails, with a upper arm cuff, pressing the blood pressure recording button 3 or 4 times and discarding the first two highest readings and taking the average of the subsequent 2 readings. And the reason we ask you to do this is to mitigate or to remove the impact of the stress of your first reading, or of settling down in the chair for your first reading, which is almost always going to be artificially raised and not a true reflection of your actual blood pressure. So if you have a persistently elevated blood pressure that you cannot understand, one thing worth thinking about is whether or not you might have an underlying metabolic or endocrine abnormality, or indeed whether you have a structural abnormality either in your kidneys or the blood vessels. If you need advice, either see your GP or book an appointment to see a cardiologist at Welbeck.